But in the midst of the gloomy figures from the novel virus, countries like Czech Republic, Denmark, Austria and Norway are gradually easing out of restrictions to curb the spread. Let's now examine what the rest of the world should do when the pandemic is over. And joining me from Lagos is Dr. Olushola Sokefun, visiting scientist, University of Pavia, Italy. Thank you for joining us on the news.
Thank you very much. Good evening, Nigeria.
So what do you envisage will...
Good evening.
Yes, good evening. What do you envisage will happen after the coronavirus pandemic, particularly with healthcare infrastructure around the world?
Well, there are indications that it has shown the weaknesses in our system as a country, and it's another chance for us to, a large extent, develop a health sector with emphasis on the universities, research institutes, and several other ancillary organs. It shows that they are weak and they are not able to do anything really in the face of the pandemic. I see a situation where we should prepare for future occurrences of this, because this can occur several times. It just tells you that there's a break in the balance in nature. Viruses have existed and they're as old as man. And if you have a pandemic of this nature, it means that there's a tilt in the balance. It's either that the virus has changed and has become very competent in infecting man, or that something in man has also changed to make man more susceptible to the virus. So this complex balance we must begin to examine. We must empower the health sector through institutions, universities and all that. And we must also continue to train experts, virologists, epidemiologists, bioinformaticians, genome biologists, experts in data science, who are able to make very meaningful things out of the current data that we have. One clear thing, which is summarily, can be completed summarily, is the fact that the African is a bit more resistant to the virus. And these numbers, if they are testing properly, clearly depict that. So it is important for us to look at several factors around our element of being resistant to it as a way of preparing us for such challenges when they would come in years to come. It's also important, I hope the health sector is doing this, that we must keep biopsies of all persons that are sick, either they are symptomatic or asymptomatic, persons that get healed, those that died. This is important for future references. We need to check a comparative analysis of the genome of the African, the Asian, the American, and the European will certainly tell us something about the immunity cascade that enhances our element of being less prone to deaths as it is currently. I hope we are testing properly. There's also an increase, a need to increase the number of testing places. Centers of competence for doing these tests must also be built up. Importantly, my dear Ma, a lot of animals that you find around us, bats, pangolins, shrews and all that, are carriers of viruses that exist with them without any problems at all. Now, when there is a zoonotic transmission between these animals and man, then there is a problem. I think this is the time to characterize all viruses, what is called the virome of these animals, and then test them on live cell lines in the laboratory to see how effectively you can control them, should or in case there's an outbreak. The options are many. This is the time to test the traditional medicine sector. There are claims and counterclaims that, they can do all sorts. I think it's the time to test their abilities.
Of course, the implications of coronavirus pandemic on our lives are multifaceted. I wish we could
Yeah.
continue the conversation. Dr. Sokefun, thank you for your time on TVC News at 10. The outbreak of the coronavirus disease may have shut down the English Premier League, but it has not shut down transfer talks. Arch rivals Liverpool and Manchester United are in a two-way battle for 16-year-old English teenager of Nigerian descent, Carney Chukwuemeka. The Aston Villa player is regarded as the best 16-year-old in England at the moment. The teenage midfielder is also believed to be on Manchester City's radar, but Villa are hoping they can strike a deal with the youngster and hand him a contract extension once the coronavirus crisis is over.